us, we're looking for a different way to recruit. Difficult recruiting market, healthcare is changing. We recognize change is coming, and how do we participate in the future of that, not the past.
Do you remember when we first graduated from school and when you were going out to get a job, you like shut down all of your social media profiles?
Making sure your privacy settings were very tight.
Everything. Yeah. It's so interesting. In like 5 years, it's totally 180'd.
And I think that one thing that's important to keep in mind is it's all about the patient. It's all about providing quality patient care, the best possible care, whether it's a hands-on patient care provider, technology leader, or food service, whatever it may be. We have to get the best talent.
And where does that best talent live?
LinkedIn. Just kidding.
With the millennial generation nowadays, they really are looking towards social media to find a lot of their opportunities. So we really wanted to be one of the first health systems to really tap into that. I'm still at that stage where I get really excited if I get one more follower on anything or like. We really are focusing right now on developing our strategies with our hiring managers.
Millennials are very important. I think as we look at the demographics of sort of who is going out and coming into the organization, when you look at the new grad nurses that we're bringing into the organization, these are people that are using Pinterest, Instagram, social media on a daily basis. So these are sort of the ways that we need to focus to engage, because in the future it's really going to be the core forefront of our hiring and talent acquisition.
The millennials, yes, there's a much greater acceptance, it's a much easier audience. But in the healthcare space, probably 60% of all the folks we need to talk to are not millennials. And for us, it's how do we reach that group the same way? And the way you're going to get to them is to move them into a millennial mindset.
One of the big wins that we've recently had was an event that we did with IT. The goal was, we have X amount of positions, we need to fill these positions, how are we going to do it? So we actually went about it by launching a talent community, giving a sneak peek into what is IT at Mt Sinai Health System. Video, brand, success stories, and you could apply with your LinkedIn profile, your Facebook profile, you could drag and drop a traditional resume. We had 650 people join in 2 weeks and then invited 125 people to an interactive IT event fair. Walked away hiring, I believe, 16 people that day and saving hundreds of thousands of dollars.
Absolutely.
Wow.
One of the things that I thought was extremely important is really presenting an organic picture of who you are. Do you guys do anything similar?
We do. I'm huge on define your culture. I mean, what you guys have done, I was listening to what you said, we spent a lot of time on our company page, not to communicate our offer, not to communicate your daily work life. We want to communicate who we are, what we represent, our culture. And that's what we find engages people. And again, listening to what you did, that's exactly what you did.
So now that we've had the success with piloting that in the IT community, we now are doing a similar pilot with nursing. And so I'm excited to see how today goes with nursing and really to continue to expound upon these ideas across other parts of the organization.
Culture is one of the biggest differences that a team has to offer when it comes to the candidate experience, because when you think about the work that healthcare professionals do, it's pretty similar job to job. So what is it that you're offering that's different than what they already have? The leaders in the industry right now who are doing really well in healthcare are focusing on culture, and that tends to be what I'm hearing from you guys.
And I think the hardest thing for us was, from a CRM perspective, we had to really, really push that, is it about the short term or the long term? The easy win in recruiting is find the position being screamed about the loudest and fill it. You're the hero of the moment. There's no question about it. I mean, it's universal, works everywhere. The real solution is to have that long-term connection with people. We try to serially engage. We haven't found too many avenues that allow that. The classic paper and pencil resume processes really don't work because they're only live on one side. We reach out, we get a response. Whereas with the LinkedIn process, since people are updating their profile, that keeps them engaged with us. And so that's probably our biggest challenge, is how do we keep that constant communication going? If it's about the short term, there's better ways to go that are quicker and cheaper. Unfortunately, they don't last very long. If you're really looking for a powerful CRM system, it's that serial engagement thing.
Anytime you're wanting to drive some change, they're going to say, well, the way that we've been doing things is kind of working. But when you look at the industry as a whole, you see that you're going to need to embrace that change and embrace the way that individuals are using technology. It's much more integrated in their daily lives.
You know, the way that Mike's role evolved into a data role was so we can really prove the value that we have. We have data that shows this is what's happening. And so he's able to show that this is what the data is showing. And so over time, they're like, okay, you know, they want to get it and they support it, but the more you educate them and show the data that backs it up, then it really starts to click and they support that change more.
At the end of this year, if you guys are to take a look back and define success for yourself and your organization, what would that look like?
My dream headline would be 50% of Mount Sinai's hires coming from social media, and how much money we've saved from that.
After a little over a year of involvement with LinkedIn, it's going to really come down to we've gone in a robust manner with basically all facets of it. We've already seen a lot of successes. For us, it's going to be what's the depth of the pipeline. I mean, is the pipeline fuller now than it was? Certainly trending that way. Certainly looks good, but that's going to be our measure at the end of the day, is how well positioned are we to hire? And that's going to be the win for us at the end of the year, and that's what we'll be looking at.
I think at the end of the year, what's going to be probably the biggest win for me personally, but also for the organization, is sort of the transition that we've made from old style approach to talent acquisition metrics and leveraging the new technology to be able to make the best hires they can make.
By taking what are non-traditional approaches to recruitment, especially within the healthcare space, you really can over time transform patient care in New York and beyond that. And so seeing the impact of that at the end of the year, I think, is going to be really tremendous.